I do not think stricter gun laws are the best solution to reducing gun violence because criminals will still find ways to get weapons no matter how many restrictions are passed. Law-abiding citizens are usually the ones most affected by gun control laws, while dangerous people ignore them anyway. I think increasing security in schools and public places would be more effective because it could stop threats before they happen. Metal detectors and armed security may make schools feel stricter, but safety should come before comfort when it comes to protecting students. I also think trained teachers or staff carrying firearms could help stop shootings faster, since police are not always able to respond immediately. Of course, there would need to be strong training requirements because not everyone should carry a weapon in school environment. Some people worry this could increase risks, but having responsible adults prepared for emergencies could save lives. Mental health support is also important, but it cannot prevent violence on its own. Overall, I think stronger security measures and trained armed protection are more realistic solutions than adding more gun restrictions. The government should provide free healthcare to everyone because it would likely lead to much higher taxes and more government control over medical decisions. While healthcare costs are definitely a problem, government-run systems in other countries often struggle with long wait times and limited access to specialists or certain treatments. I think competition in the private healthcare system helps encourage better quality care and medical innovation. The United States leads in a lot of pharmaceutical research and medical advancements, and too much government involvement could slow that progress down. Free healthcare is not also truly free because taxpayers would still have to pay for it through higher taxes. I would also think it would be difficult for government to efficiently manage healthcare for millions of people without creating waste or inefficiency. There should definitely be programs to help lower income families and people who cannot afford insurance. But I do not think the government should completely take over healthcare. Some services like cosmetic procedures should absolutely not be covered by taxpayers. Overall, I think improving the current system makes more sense than switching to a fully government-funded healthcare model. I do not think the government should establish safe consumption sites because it risks normalizing and enabling dangerous drug use instead of encouraging people to quit. Even though the goal is to reduce overdose deaths, providing places where people can legally use drugs sends the message that society accepts these behaviors. I think public resources would be better spent on rehabilitation programs, prevention, and stricter law enforcement rather than creating spaces for drug use. Addiction is a serious issue, but personal responsibility still matters, and there should be consequences for illegal drug activity. Some people argue these facilities save lives, but they could also attract more drug activity and crime into nearby communities. Taxpayers should not be accepted to fund places where illegal substances are being used. I also think safe consumption sites could weaken prevention efforts because younger people may see them as proof that drug use is becoming more socially acceptable. Helping people recover should be the focus, not making drug use safer or easier. Overall, I think stronger rehabilitation programs and tougher enforcement are better long-term solutions to the drug crisis than government-sanctioned consumption sites.